Hello everyone, I am Kyla F. Linguaje, first year nursing student, and today I will be performing parenteral medication administration in this video. So this is done in order for us to allow easier absorption of medication, especially for those patients who are vomiting, nauseated, or restricted of taking oral fluids or unable to swallow. So the first thing that we need to do is to check for the physician's order. This is to confirm the order. And next is to check the label against the MAR. This is to ensure that the correct medication is being prepared. Next is to follow the checks of administering medication. Read the label when taken into the medication cart before and after the withdrawal of the medication. Then prepare the equipment. This is to promote efficiency of the procedure. And now let us begin. So the first thing that we need to do is to perform hand hygiene. This is to prevent cross-contamination. Then prepare the vial. Then confirm. Then open the vial, the protective cup, or clean the rubber cup if the vial has been opened. This is to um, reduce the number of microorganisms. Use an antiseptic wipe. Then clean with circulating motion. Then discard. Now is we're going to withdraw the medication. Grab the syringe, then attach the filter needle firmly into the syringe. So filter needle is helpful in order for us to prevent withdrawing the solid particles. Then remove the cup. Then draw up air in equal to the volume of the prescribed amount of medication. Air is helpful in order for us to easily withdraw the medication from the vial. Now, insert the needle into the middle of the rubber cup of the vial. Then, inject the air. Invert the vial. Make sure that the tip of the needle is touching the medication. Then, gradually withdraw the prescribed medication. Then, recap. Then, dispose the filter needle into the sharps container. Then, replace the needle with the needle that we'll be using for the administering of medication. And then review. Next is we're going to prepare for the ampule withdrawal. First is to confirm. Now flicker the upper stem of the ampule several times. This is to bring down all the medication into the main portion of the ampule. Then place a sterile gauze pad on the neck of the ampule. Then break towards us and dispose the broken glass right after. Sterile gauze pad is helpful in order to protect our fingers from the broken glasses. Dispose. Then place the ampule into the flat surface. Now, withdraw the medication, grab the needle, grab the syringe, then remove the cup, and make sure that the filter needle is attaching into the syringe. Attach the needle firmly, then remove the cup. Now hold the ampule slightly towards the side. This is in order for us to obtain more than the amount of medication prescribed. Make sure that the tip of the needle is not touching the tip of the shaft. Then recap and remove the needle into the sharps container. Then replace the needle that we'll be using for the administering medication. So before entering the patient's room, make sure to check the room number and also to make sure to introduce yourself and identify the patient's identity. This is to ensure that we are giving the medication into the right person. Hello, ma'am. Good day. I am Kalef Lingwahe, your student nurse for today. So may I know your name, please? And your birthday, please? Alright, so what do you want me to address you, ma'am? Alright, so Ms. Dawn, I will be assessing or administering the parenteral medication administration. So this is done in order to allow quicker absorption of medication, especially for those patients like you who are restricted on taking oral fluids. So do you have any clarifications, ma'am? None. Okay, so now I'll be performing hand hygiene and wear my gloves. This is to prevent cross-contamination. Alright, so now ma'am, let's proceed to the intramuscular injection. So first I will be assessing you to a sitting position. Then select the target site, which is the deltoid site. So ma'am, I will be administering the paracetamol. This is to reduce the pain and fever. So side effects are vomiting, headache, and dizziness. So do you have any clarifications, ma'am? Alright, now. Next is select the injection site that is free of lesion, inflammation, tenderness, since it might hinder the absorption of medication. Now is clean the site with antiseptic wipe and then discard. Then grab the syringe, remove the cup, then using the non-dominant hand, put the skin into the side at approximately 1 inch. This is to facilitate the needle insertion. Then hold the syringe with the thumb and the four fingers and insert the needle at 90-degree angle. Then hold the barrel and with the non-dominant hand and the other will aspirate. Then continue inject the medication slowly. Then withdraw the medication with the same angle of insertion. Then apply a cotton ball and gently add pressure. Then discard the needle into the sharps container. Then don't forget to document all the needed information. This is to serve as means communication and to confirm the medication. Now is we're going to proceed for the subcutaneous injection. So now I will be administering a regular insulin. This is to control the blood sugar since you are a diabetic patient. So the side effects are vomiting, headaches, and fever, and possible hypokalemia. So do you have any clarifications, ma'am? Alright, none. Next is we're going to again clean the site of the injection site with the antiseptic wipe. Then discard. Now grab the medication syringe, remove the cup. Then using with the non-dominant hand, pinch the skin of the abdominal side. Then insert the needle at a 45-degree angle. Then continue inject the medication slowly. And put a cotton ball and gently apply pressure. Then discard the injection or the syringe into the sharps container. And don't forget to document all the needed information. Now we're going to remove the gloves and perform hand hygiene to prevent cross-contamination. So now that I'm done administering a parenteral medication administration and also the intramuscular and subcutaneous injection. So again, this is Kayla Flinguahe, first year nursing student. Thank you and have a great day.